Hey guys, Dr. TJ back here again with Tuesday Tidbits. We're going to be talking about tennis elbow, lateral epicondylitis, okay? Pain right here. This comes from repetitive motions. Carpenters get this a lot. This is a little bit different than golfer's elbow. That's medial epicondylitis, okay? Same exact thing though, just different location. It's a tendinitis, okay? So the extensor muscles of the arm come up into the arm, they attach up into here. When these muscles get overworked or too tight, or trauma or micro traumas from repetitive motion, the tendon gets mad, swells up, puts pressure on the insertion of the bone, that swells up, and now you got pain every time that you grab something, pick something up, turn your arm, and it hurts. Okay? So now we got to try and calm that down. So what can you do at home? Piece of cake. You can ice it. I would ice right at the tendon. Okay? You could do muscle rub over the muscle, trying to get the muscles to calm down so not putting so much pressure on the tendon. Okay? A good muscle rub that we use here is just straight up peppermint oil. That works phenomenal for this type of things. You can do massage on the arm. Okay, you can get a tennis elbow brace. Now, not all tennis elbow braces are made the same. Okay, you want to make sure that they are not too wide in diameter because that doesn't put as much pressure on there. You want them nice and small. Okay, and a lot of them have a pad that comes in here, and that pad will go right over the muscle. So in this case, right over this extensor muscle, and you wrap it up as tight as you can without causing numbness in your arm. What that does is that's going to put pressure on this muscle and take pressure off the tendon and allow that to heal. People do a lot better with that. It's also going to approximate your radius and ulna, and that can take pressure off the joint too, and people do a lot better that way also. So get a tennis elbow brace. If you don't know of a good one, come in here, we'll get you one. Okay? So tennis elbow brace, ice, muscle rub, start stripping out this muscle, and you'll do a lot better. If that doesn't work, sometimes you gotta go further and get a little adjustment done. Okay, and we'll go through, we'll do some therapy. I like to do interferential and laser therapy combination on these things. Increase circulation, decrease inflammation, get the tissue to heal. We'll do adjustments. People typically don't do a hard enough massage on themselves. Okay, so if you're trying to massage this out yourself, you might get some results. But if you need something a little bit more rigorous, you come and see us, because we'll torture you. But it'll be worth it. Everyone comes back for a second round of torture. Not sure why, but it helps, okay? So we'll go through, we'll massage that a little bit more. Acupuncture can be beautiful for this thing. Danette, our wonderful acupuncturist, she does phenomenal work with tennis elbow. So don't be afraid to get that done too. Little take-home tidbits, you can do the exact same thing with the medial epicondyle, so if you have pain in through here. If for some reason you've caused an avulsion fracture, which is where the tendon actually pulls off a piece of the bone, that can be a lot, a lot more stubborn of an issue and not recover as quickly. Okay, there's not a lot we can do for repairing that unless you have torn tendons. Okay, the only way to diagnose torn tendons would be MRI. Avulsion fracture can be diagnosed with X-ray. So if we can't get the results that we're looking for, a lot of times we refer on and get the X-ray. Typically speaking, we don't start out with X-ray because a lot of times we can get people a lot better faster and don't have to worry about spending that extra money. Okay, and that's one thing we pride ourselves on here. We don't like to make people come back every 3 times a week for the next 12 weeks just to try and work on a little tennis elbow. We'll get you better faster and get you out the door. All right. Now, one thing with the collagen and tendon repair. This is a new product that we just started to get in. This is Dr. Axe's multi-collagen protein, okay? This is wonderful to repair your soft tissue. This is good for joints. This is good for your tendons, your ligaments. This is even good for the collagen that's found in your organs, okay, in the tissues around there. This has type 1, 2, 3, 5, and 10 collagen fibers, okay? This is very important for health. So if these types of things aren't healing, it could be that you're just not having the proper supplementation to allow that tissue to heal. This could be a big factor, okay? So you guys are curious about this, you can find a lot of information on Dr. X's website. You can come in and talk to us or ask us information. We'll send you as much information as you want from this. This is a great product. We just started carrying this, okay? If you have any questions on tennis elbow, please just call or email us. FullTheFamilyChiro.com. 507-425-0025. Dr. Sarah, she's over in Edgerton Chiropractic, 507-631-7565. And Danette, she works acupuncture in both clinics, all right? So if you have any issues with tennis elbow that's not recovering with the tennis elbow brace, the icing, and the muscle rub, let us know, all right? Again, you guys have a great rest of your week. We're going to unleash a big dog next week. We're going to discuss some thyroid. Okay, we got thyroid people coming in here, have a lot of questions. So we're going to throw a lot of information at you next week about thyroid issues. All right? We'll see you guys next week, and again, have a good week.